cognitive or neurocognitive disorder, still based on the DSM-5 TR. Delirium is an acute fluctuating disturbance in attention and awareness. So, delirium happens suddenly. Unlike dementia, which is gradual, it is serious temporary mental state change where people become confused, disoriented, or even have trouble focusing. It usually indicates an underlying medical issue that needs urgent care. According to DSM-5 TR, there are actually five main criterias. So, first is disturbance in attention and awareness. It is reduced ability to focus, sustain, or shift attention. Next, develops over short period, usually hours to a few days, and fluctuates. Third, an additional disturbance in cognition such as memory deficit, disorientation, language disturbance, or perception or hallucinations. Next is it is should not be better explained by another neurocognitive disorder and does not occur in coma or in being comatose. Five, there is evidence that it is caused by a medical condition, substance, or toxin. So, when diagnosing delirium, the most important features are sudden onset, fluctuation, and problems with both attention and cognition. We must always look for an underlying medical or substance related cause. So, what are the key features? Unlike Alzheimer's, delirium develops quickly. A person may be fully alert in the morning but confused by the evening. So, this is delirium. The good news, it's reversible if caught early and treated early. Okay. So, there are actually types of delirium. Hyperactive, they experience restlessness, agitation, loud or aggressive behavior. Hypoactive, they are lethargic, they have reduced alertness, they are sluggish, or they often miss or mistaken for depression. Third, the mixed type, wherein they have they are alternating between hyperactive and hypoactive. So delirium is not always loud and restless. Some patients are quiet and sleepy. That's hypoactive delirium, which is usually the most underdiagnosed type. So some they mistake it with depression. There are actually common causes of delirium. Delirium always has physical or medical trigger. It's like even something as simple as dehydration or urinary tract infection in older adults can cause sudden confusion. What are the risk factors? Delirium is common among older adults, especially those already diagnosed with dementia. So hospital environments and multiple medication can worsen confusion. Okay. So this table helps differentiate delirium from dementia. Delirium starts fast, it's sudden, and changes rapidly, while dementia is slow and steady. One key sign is delirium affects attention and consciousness right away. Okay, so you need to remember those. So calm or confusion assessment method, it is most widely used bedside tool. It is acute onset or we use tools like CAM to confirm delirium. It focuses on sudden onset, poor attention, and fluctuating mental state. Always pair this with medical evaluation to find the cause. So you need to have laboratory checks. You need to start with laboratory tests even. So the duration could be hours to weeks depending on the treatment. So delirium can appear in hours or linger for weeks. The key is early detection. Untreated, it can worsen outcomes or trigger long-term decline. So the best treatment for delirium is to fix the cause, not just to medicate. So gentle reorientation can actually help the patient. Gentle orientation with familiar faces or a calm environment can make a huge uh, difference. What are the types of uh, calm environment, like reducing sensory overload, like quiet environment, a room with good lighting, and then you give medication only when necessary for severe agitation. Haloperidol is for people to be calm, right? So para di sila mag-lash out or being aggressive. So in hospitals, nurses play a vital role. Like simple steps like reorienting, providing reassurance, and reducing noise can prevent worsening of delirium. So delirium is often preventable. Small interventions like hydration and proper sleep can drastically reduce its occurrence. Okay, so let's have a quick review. So remember, delirium is an emergency, not just forgetfulness. The faster we find and treat the cause, the faster or the better the recovery will be. So the causes can be medical, neurological, or substance-related abuse and not just aging. So it's characterized by fluctuation, uh, the difficulty in terms of awareness and cognition. So again, early detection saves lives. It prevents long-term damage. So that's it. I hope you will continue with your performance task.